Did you ever wonder how your medications get filled? What does a pharmacist even do? First, you have to see the doctor to get your medication. Then, the doctor will send the pharmacy a prescription in one of three ways. It can be a written script given to you that you have to physically bring to the pharmacy. The doctor can also send it electronically, which usually takes about 30 minutes, so please try to be patient. This is the safest way in my opinion. And lastly, the doctor can just call it in. After we get your script, we have to process it. There are multiple checkpoints we have to assess. First, we have to make sure your insurance covers your medication. This is the worst for all pharmacy technicians because usually nothing is covered. Next, we have to make sure that there aren't any side effects you might get, such as allergies, or if you have drugs interacting with other drugs. And if you have a good pharmacist, he or she will make sure this is the most effective and cheapest medication for you. After we process the medication, a label comes out with the patient's information, the medication, and the receipt. The technician will see what drug they need to get from the aisle and bring it to the pill counter. This is the longest part of the pharmacy process. If you are lucky and have an amazing boss, you will have a small machine that will count for you. We call him Kirby. By the way, this machine costs thousands of dollars. Just imagine a technician will do this over 200 times in their shift. After the technician is done filling, it finally gets sent over to the pharmacist for a final check. Then your prescription is all ready. Well, not quite. The pharmacist, as well as checking over 200 scripts, has to do other things as well. He or she has to make sure your medications are in stock and find your medications if they do go on back order. At the same time, we have to make sure that these medications are bought for a fair price, to keep the pharmacy afloat. Pharmacists also have to give immunizations. This is the worst because you have to leave your area for at least 10 minutes, and when you come back, it is literally mad chaotic. And lastly, we counsel. Patients tend not to understand how their medications work even after speaking with their doctor. We try to spend a lot of time with each and every one of you and try to ease any anxiety you may have, especially during COVID-19. I hope this video has given you insight on all the jobs a pharmacist does in a day. Always be kind to them. Thanks for watching.